There's a great partnership between certainly us and Spectra, a great corporate contributor, but I also know with their involvement with the Northern Medical Program that there's a perfect tie-in, because they help us fund equipment that the University Hospital needs, and in turn, second, third, fourth year medical students get to use that same equipment to practice and train and stay in the North once they've graduated, so it's worked out very well.
The training of doctors in this part of British Columbia is very important for us, because we can see the connection, the direct connection between working with the hospital, with universities, and with the hospitals in Northeast BC to be very important in supporting this idea of healthy communities, not only in theory but in practice.
Well, Spectra's helped the student program on many levels, but the most important is that the students are able to be involved in the care of patients using the specialized equipment that without Spectra's help wouldn't otherwise be available.
But just recently they ended up helping to fund a vital signs monitor, which is another piece of equipment that medical imaging can use, greatly needed, and we took them for a tour to show them the good work they've done, and it was very well received.
The cardiac output monitor allows the anesthetist to monitor the patient's fluid balance far more effectively than traditional methods where they would actually be very invasive.
We are beginning to learn how to read the images off of imaging equipment. So the training begins with being able to understand what it is you would be looking at prior to actually using the equipment.
It's leading edge technology. It really is. And students that from the medical program we get from the Lower Mainland come here to the University Hospital, see these tools in use in practical application. And this is where sometimes they get their first experience with this kind of technology.
So I'm really loving being in the program, and I'm particularly happy that I could stay in the North, because this is where I intend to stay and practice.
But the end result, what it has given us, is it has allowed us to increase the ability to give cutting-edge medical treatment here in the North. The other thing that it's done, of course, is we have a medical school here in the North, and allowing the ability of our students to interact with these new technologies.
So when equipment and facilities that are as good as they are here are available to us, you attract the best and the brightest as you should.
Spectra's been a very strong supporter for healthcare in Prince George and indeed the entire North.
They not only help us in Prince George with the UHNBC, but they've also helped us in Quesnel, and I know they do a tremendous amount of work with some of our sister foundations up in the Northeast sector as well.
We're local. We're in Prince George. We're in Fort St. John. We're there for people to pick up the phone and call us, or we bump into people at events. We're closely connected to these communities, and that's a key component in our community relations.